All right, so you know how we always talk about how autism therapies aren't one size fits all?
Yeah.
Well, a comment we got recently about ABA, applied behavioral analysis, really kind of
Mm-hmm.
really got us thinking about that again.
It's a topic that always gets people talking. And
Yeah.
for good reason.
Yeah, definitely. And this one really focused on the idea that maybe ABA focuses too much on making autistic people uh,
Uh-huh.
act like everyone else, instead of respecting how they are naturally.
I see. Yeah, that comes from some of the older ways ABA was done.
Ah,
And those older ways, well, they relied a lot on punishment to change how someone acted.
oh, wow.
So think about like a classroom, right?
Yeah.
Where a kid gets in trouble for flapping their hands or rocking back and forth.
Oh,
That's the kind of stuff that made people criticize ABA.
okay. Yeah. Because they're being told to act normal.
Exactly. It was all about fitting in.
Yeah, it's almost like those old medical practices we know now didn't work.
Oh, like.
Bloodletting?
Yeah, yeah. It makes you wonder, how did ABA change from those early days?
Right. How did it get better?
Well, just like medicine started using science more, ABA had a big shift too.
Uh-huh.
Modern ABA, it's all about positive reinforcement,
Oh, okay.
meaning they focus on rewarding good behaviors.
So instead of punishing a kid for not making eye contact,
Right.
they get a reward if they do make eye contact.
That's it. It could be praise or a little toy, something they like.
So it's less about stopping behaviors completely
Yeah,
and more about teaching new skills and using their strengths.
exactly. And another big change is focusing on each person.
Oh, okay.
Modern ABA gets that every autistic person is different,
Yeah,
with different strengths, challenges, and goals.
makes sense.
A good ABA therapist will figure out what that person specifically needs
Mm-hmm.
and then make a plan just for them.
This commenter also said something that really got me thinking.
Oh, yeah.
They were worried that ABA might make people hide how they normally cope with things. They even said they don't trust anyone who supports ABA,
Wow.
even if they're autistic themselves.
That really shows how important it is to understand,
Yeah.
like, what are the good things about a therapy,
Yeah.
but also what could be bad.
Right.
It's important to respect what people have gone through
For sure.
and realize that some people had bad experiences with ABA,
Mm-hmm.
but we can't just say everyone will have a bad experience.
So how does modern ABA make sure it's not stopping people from coping in their own way?
Yeah, that's a good question because everyone has ways to deal with stress or when things are too much, right?
Exactly. It doesn't make sense to get rid of those completely.
Right. And modern ABA doesn't try to do that.
Okay.
The goal is to help people find better ways to handle those challenges.
Gotcha.
So let's say a kid covers their ears when it's loud because they're sensitive to sound.
Mm-hmm.
ABA wouldn't just try to make them stop doing that.
Right.
Instead, it might help them learn to say, hey, can we go somewhere quieter?
Uh,
Or to use headphones that block out the noise.
So it's more about giving them tools and options.
Yes, not changing who they are, but helping them have more choices.
That makes a lot more sense.
And don't forget, ABA is all about making people more independent.
Right.
The goal is to give them the skills to live their best life.
Okay.
Not to fit into some mold, but to be themselves and be happy.
Yeah. And that's really different.
It is.
And it reminds me of something else the commenter said.
What's that?
It almost felt like they didn't even want us talking about ABA.
Hmm.
Like they said, you won't grow this channel if you support ABA.
Oh, wow.
This idea of shutting down conversation, does that worry you?
You know, it is interesting.
Yeah.
It shows how personal experiences can clash with wanting to learn more.
Oh, I see what you mean.
It's understandable that someone who was hurt by a therapy wouldn't want anyone to use it.
Yeah.
But trying to stop people from talking about it,
Mm-hmm.
that just keeps everyone from understanding more.
It's like ending the conversation before it even starts.
Yeah. And especially with something as complex as autism therapy.
Right. There's no one answer for everyone.
No, there isn't.
So we need these open and honest discussions about the different ways to help.
Absolutely. If we only hear one side of the story,
Yeah.
we miss out on learning from each other.
And figuring out what might work best for us or the people we care about.
That's right.
It seems like this person thinks there's only one right way to see ABA.
Mm-hmm.
And if you don't agree, you're wrong.
It does make you think about how divided the autistic community can feel sometimes.
Yeah.
And the whole point of neurodiversity is to recognize that everyone's different.
That's so important. Autism isn't just one thing.
Right.
It's a whole spectrum of experiences.
It is.
And we can't ignore those differences or act like they don't matter.
Absolutely not. And,
Mhm.
just because someone is autistic
Yeah.
doesn't automatically make them an expert on ABA or other therapies.
Oh, right. That makes sense.
Their experience is important for sure,
Yeah.
but it doesn't mean they speak for the whole autistic community.
So, as listeners, how should we think about these tough conversations about therapies?
Yeah. How do we make sense of all these different opinions?
Exactly.
I think the biggest thing is to think critically
Okay.
and make decisions based on good information.
Hmm.
Don't just believe what someone says because they have the same diagnosis as you.
Right.
Do your research.
Hmm.
Talk to professionals who know what they're doing.
Yeah.
Consider all sides of the story
Okay.
and then choose what feels right for you, what fits your needs.
That's good advice. And there are a lot more therapies out there than just ABA,
Oh, absolutely.
like speech therapy, occupational therapy, and sensory integration therapy.
All of those can be really helpful for different things.
So many options.
It's like having a toolbox full of different tools, right?
Mm-hmm.
You wouldn't use a hammer for every job.
No way.
You'd pick the tool that works best for that specific job.
Right.
Autism therapies are the same. Each one has good things and limitations.
Mm-hmm.
And the key is finding the one that fits the person best.
So if we look beyond this one comment and think about the bigger picture,
Okay.
what should our listeners take away from all this?
What should they keep in mind when they hear these discussions about different therapies?
Especially when people have such strong opinions about them.
I think the most important thing is to think for yourself. Use your head.
Okay.
Don't just accept anyone's opinion as fact, even if they have the same diagnosis as you.
Gotcha.
Look things up,
Huh?
talk to real experts, get different perspectives,
Uh-huh.
and then choose the path that feels right for you based on what you need.
That's such good advice.
It's easy to get caught up in the emotions of it all,
Yeah.
but in the end, it's about finding what works best for each person.
And that might be different for everyone.
Exactly. No one solution works for everyone when it comes to autism therapy.
Yeah.
That's why it's important to be open-minded.
Mm.
Be willing to learn and be respectful even when you don't agree with someone.
I totally agree. And I think it's important to remember that even within ABA,
Oh, yeah.
there are lots of different approaches.
There are.
So just because someone had a bad experience with one type of ABA
All right.
doesn't mean the whole approach is bad.
That's a great point. It's like saying all doctors are bad.
Haha. Yeah.
Just because you had one bad experience with a doctor.
Sure.
It just doesn't make sense.
It really doesn't.
You have to look at each person, how they do things.
Yeah.
And if their way fits with what you want and believe.
That's a good way to put it.
And don't be afraid to ask questions. Speak up for yourself.
Mm-hmm.
And get a second opinion if something doesn't feel right.
Okay.
You get to choose what therapy works best for you.
This has been a really good conversation, even though it came from a negative comment.
I think so too.
It made us think about some really important things
Yeah,
when we talk about these sensitive topics.
definitely. And I hope it helped our listeners think critically, talk to each other with respect.
Yeah.
And make smart choices for themselves.
Before we finish this deep dive,
So-
I have one last question for everyone listening.
All right, hit me.
If one size fits all doesn't work for autism therapy, what should people consider when choosing a therapy?
And, it's important to remember that things are always changing in autism therapy.
Oh, right.
Like, new research is coming out all the time.
Yeah.
People are finding new ways to help.
Mm-hmm.
So we have to keep learning and be open to new ideas.
It's not about saying one therapy is the only answer, right?
Exactly.
We have to be willing to change as we learn more.
That's where things like this deep dive are so helpful.
Oh, yeah. I see what you mean.
We talk about different ideas, look at things from different angles,
Yeah.
so people can make good decisions based on what they know.
And speaking of making good decisions,
Mm-hmm.
you mentioned earlier that just because someone's autistic doesn't mean they're an expert on ABA or other therapies.
Right. Could you talk a little more about that?
I think some people believe that if you've experienced something,
Ah,
then you're automatically an expert on it.
that's a really important point. And
Yeah.
while personal experience is valuable, it doesn't make you professional.
Right. Like, I wouldn't expect someone who broke their leg to be a doctor.
Exactly. You wouldn't go to them to fix your broken leg.
No way.
And it's the same with ABA.
Okay.
Just because someone received ABA therapy
Mm-hmm.
doesn't mean they have the same knowledge as a trained ABA therapist.
That makes sense. It's like being a movie critic versus a filmmaker.
Yeah, I like that.
You might have opinions about movies,
Right.
but that doesn't mean you know how to make one.
Exactly. Being an expert takes years of learning, training, working with people, and keeping up with the latest research, the best ways to help.
So we should listen to what autistic people say about their therapy experiences,
Absolutely.
but we also need to get advice from real professionals.
Yes. The ones with the knowledge and skills to assess, diagnose,
Mm-mm.
and give treatment based on what actually works.
It's like valuing both sides, the personal experience and the professional expertise.
That's it. They both bring something important to the table.
And by putting those together, we can really understand autism better.
In all its complexity.
This whole conversation has shown how important it is to think critically,
Yeah.
especially when we're learning about autism therapies.
It's so easy to get caught up in what other people say,
I know, right?
or to let our emotions take over.
Yeah, but we have to step back and look at the evidence. Where's the information coming from?
Right. Is it reliable?
Or could there be biases? Are they trying to sway us in a certain
You
direction?
got it. It's like being a detective.
Ooh, I like that.
Looking for clues, figuring out what's true and what matters to you.
And it's not about ignoring our feelings or personal experiences.
No, not at all. Those are important.
It's about finding that balance,
Between our head and our heart.
using both evidence and empathy to guide us.
You said it perfectly.
Mhm.
This brings us back to that key point we keep talking about.
Which is,
Individualized treatment. There's no one-size-fits-all for autism.
and that means there's no one-size-fits-all therapy either.
Exactly. Every person needs something different.
This makes me think about how important it is for people to speak up.
Yes.
Like families and individuals need to feel like they can advocate for what they need.
Especially when it comes to autism therapy.
They shouldn't be afraid to ask questions or say what they're worried about.
Absolutely. And they need to find a therapist who gets them.
Someone who understands what they're going through.
Someone who listens to their goals.
And they shouldn't be afraid to try different therapies
Mm.
or even combine them, like use a few different approaches at once.
It's all about finding what works for that person at that moment.
Because what works for one person might not work for another.
Right. And what works at one point in your life
Mm.
might need to change later on.
So being flexible is key. Being open to trying new things.
And always putting the person's well-being first.
So for someone who's just starting to learn about autism therapies, what would you suggest they do?
What are some important things to remember? First, learn about the different therapies out there.
Okay.
Read books, articles, look at good websites.
So do your research.
Yes, get a feel for the different approaches, what they offer.
It's like making a map of all the autism therapy.
Oh, I like that.
You want to know the landscape before you start your journey?
Exactly. And once you have that basic understanding,
And what?
start talking to people.
Okay.
Connect with other autistic people and families.
Mm-hmm.
Go to support groups. Reach out to organizations.
Tap into that community knowledge.
Yes. Learn from those who've been there before.
That's where those personal stories and experiences are so helpful.
They are. And don't forget about professional guidance.
Oh, right.
Find a therapist who specializes in autism.
Someone who can help you figure things out.
Exactly. They can help with diagnosis, assessment, making a treatment plan.
Like having a guide to help you read that map we were talking about.
Exactly. They can give you directions, insights, support you along the way.
And it's okay to ask for help, right?
Of course, this can be overwhelming.
Yeah, there's a lot to take in.
And there are people who want to help you. Don't be afraid to reach out.
We've talked about staying informed, getting guidance, embracing individuality. But what about the emotional side of things?
Oh, that's so important.
It can be tough, especially if you're newly diagnosed
It could be a lot to process.
or if you're facing challenges and don't know what to do.
That's where taking care of yourself becomes crucial.
Okay.
You have to prioritize your own well-being, mental and emotional.
Yeah.
Find healthy ways to cope, connect with supportive people. And if you need to, see a therapist yourself.
It's like putting on your own oxygen mask first on an airplane.
Wow, I love that analogy.
Before you can help anyone else, you have to help yourself.
So true, and that applies to so many things in life.
Definitely, especially when we're talking about autism and therapy.
Yeah, it's a journey, and you
Yeah.
have to be in good shape to take it.
So we've covered a lot of ground: critical thinking, individualized treatment.
Professional guidance, self-care.
But I want to circle back to something we mentioned before:
What's that?
respectful dialogue, being open to different perspectives.
It's a theme that runs through all of this.
It does, and it's something I feel strongly about.
Me too. In a world that feels so divided these days.
Yeah, it really does.
It's so important to be open-minded,
Mm-hmm.
to be curious, and to engage with respect.
Especially when we're talking about complex and sensitive topics.
Absolutely, like autism therapy.
And especially within the autistic community itself.
Yes, because there are so many different experiences and opinions.
We have to get away from this us versus them mentality.
Right, it's not about being right or wrong.
It's about recognizing that there are many truths, many perspectives.
And many approaches, We need to be open to all of it.
We're all on this journey together,
We
and we can learn from each other, even when we disagree.
That's how we make things better for everyone.
It's how we create a better approach to autism therapy.
By valuing each person's unique journey,
Hmm.
by respecting different viewpoints.
And by working together, trying to understand each other.
That's a beautiful way to put it.
This conversation has been so insightful.
I agree.
We looked at some complicated stuff.
But we did.
We challenged some of our own beliefs.
Yeah.
And we imagined a future where neurodiversity is truly celebrated. Thank you for sharing your expertise with us today.
It was my pleasure, and thank you for having me.
And thank you to our listeners for joining us on this deep dive.
We appreciate you being here.
Remember, knowledge is power.
It is.
And by working together, we can create a world that's better for everyone.
A world that's more inclusive, fair, and empowering. Yeah, that's a really thought-provoking question. A world where every autistic person has the support to thrive.
Yeah.
Well, it would be a world that really embraces neurodiversity.
Not just saying it, but actually living it.
Exactly.
So what would that look like in real life?
Well, first of all, we need to stop focusing on what autistic people can't do
Okay.
and start seeing their strengths, what they're good at.
So instead of thinking of autism as something to fix, we see it as just a different way of being with its own good things and challenges.
Right. Imagine schools that work for all kinds of learners.
Oh, okay.
Schools that understand sensory needs
Yeah.
and workplaces that value what neurodivergent people bring, and social spaces where everyone feels welcome, no matter their neurotype.
So everyone feels like they belong and have a purpose.
That's the dream.
Yeah.
But to get there,
Yeah.
we have to get rid of the things that hold autistic people back.
The barriers.
Yeah, like problems with healthcare, discrimination in jobs.
And just the stigma around autism.
That's right. It's about making society fair and accessible for everyone.
No matter their neurodiversity.
And it's not just about changing the rules, it's about changing minds too.
Ah, okay.
We need to stop those old stories about autism.
The stereotypes.
Yeah, the ones that give people the wrong idea.
So we can go beyond these narrow ideas of what's normal.
Right, and celebrate how different everyone is.
And that starts with listening to autistic people themselves.
They need to be the ones shaping the world that embraces them.
So what can we do, each of us, to help make that happen?
To make a world that's more inclusive for autistic people.
Yeah. What can we do individually?
Start with the simple stuff.
Like?
Learn about autism. Learn about neurodiversity.
Okay.
Look at your own biases, those unconscious thoughts you have. And speak up when you see discrimination, when something's not fair.
Be an ally.
More than just words. Take action.
Okay.
Support groups that fight for autistic people's rights. Use your voice to amplify theirs.
Even small actions can make a difference,
Yeah,
right?
absolutely. Just a kind word. A gesture that shows you understand. Being a good listener.
Those things can mean a lot.
They really can. It's about spreading kindness and inclusivity.
Creating a ripple effect.
That's a beautiful way to put it.
That's how we make real change.
One person, one conversation, one act of kindness at a time.
This deep dive has been amazing.
It has.
We tackled some tough topics.
We did.
Challenged our own thinking.
Yeah.
And imagined a future where neurodiversity is truly valued. Thank you for sharing your knowledge with us.
My pleasure. It's been great talking with you.
And to our listeners, thanks for being here with us.
We appreciate you all.
Remember, knowledge is power.
And together,
we can build a better world for everyone.
A world that's more inclusive, equitable, and empowering for all.
That's it for this deep dive. Thanks for joining us.